Ct-derived analysis to optimize preoperative surgical planning in patients undergoing minimally invasive cardiac surgery procedures is Dr. Totaro.
Thank you, Mr. Chairman, dear colleague. The study I'm going to present is the result of cooperation between our Department of Cardiothoracic Surgery at the University Foundation Hospital San Matteo in Pavia and the University of Engineering of Pavia. We created a surgical simulation lab in order to have a study on computational analysis, surgical simulation, and device evaluation. We have already had some testing study on computational preoperative simulation of surgical results. The basic concept of the paper I'm going to present is that a wide application of modern technologies in clinical practice should be, in our minds, supported and encouraged, as it could lead to a real useful support during the surgical operation planning, thus optimizing the postoperative results. The objective of this study was therefore to evaluate the feasibility of combining the capability of both free imaging softwares and technical computational programs to create ad hoc reconstruction to support the decision-making process for minimally invasive cardiac surgical procedure. These are the software we utilized, the free imaging software, the Osiris, which is very well known, and the computational software, MATLAB, who was used by our engineering cooperator. Why did we decide minimally invasive procedure? Because we had a very good experience with more than 1,100 procedures. These are data from 2009. And we know that even in this case, the choice of the best and optimal approach sometimes is not so clear. So this is how we designed the protocol. It's a multi-step protocol. The first step is from multi-slide synchronized CT scan. We had to obtain a segmentation and 3D reconstruction of the heart, and then we export this data on DICOM data, which named heart. This is this part of segmentation of the heart. It can take from 5 to 30 minutes, depending on CT quality and, of course, on the experience of the surgeon who usually does this first part, and then he can allocate on the result of this imaging the surgical spot who are important for the procedure. The second step, they are still from multi-slide CT scan. We prepared the segmentation of the patient's chest, front and back. And then on the third step, we create the window who is going to simulate the approach. So we had another DICOM segmented data. And then we assembled these two different imaging to obtain the final simulation. And you have here an imaging. We have started with reconstruction for mini sternotomy, but as you can see, we are getting also on the mini thoracotomy. This is the magnification of the imaging. You can evidence on your simulation if all the surgical spots you need are can easily accessible from the approach you chose. This was the first version of our workflow. So we used to get the pre-processing, segmentation, and obtaining of the window from the Osiris, and then all assembling the images with MATLAB. We are now slightly modified this, so we can obtain the cut and crop and surgical window directly from MATLAB. So that's reduced the time and it becomes more easily. We had a clinical impact of this. We tried because based on this reconstruction, you can decide to confirm the schedule of the surgical approach. You can modify the schedule of the approach, so changing the level, but you can also abandon the idea of minimal invasive surgical approach. And that is the result we had in terms of application. And as you can see, in 10% of cases at the end, we decided to abandon the idea of minimal invasive and we went for full sternotomy. In conclusion, so the evolution of imaging technique and post-processing tools have led to real useful support during surgical operation planning. We do support this widely application in clinical practice. We are further having some developments to implement all these phases in a unique software as a plugin of CX, and any of you is free to contact either myself or our partner engineering for any further information. Thank you very much. Thank the association for the opportunity of presenting our paper.